Good afternoon, everyone. I apologize for the brief delay. We have a lot of people joining and wanted to try to get all of our panelists on in advance, as well as allow other folks the chance to log on and join us today for the Hidden Casualties webinar. This is actually our third event around hidden casualties, and we were thrilled with the last webinar a couple of weeks ago. Wanted to remind folks that you are in listen-only mode and that we'll need a signal if you want to ask a question throughout. You can pose questions in the question box on the webinar interface, as well as asking them through Twitter. And at the end, we'll open up for question and answer as time allows. We hope there'll be some time at the end. And in that case, you'll have to raise your hand and let the operator unmute you. That said, if I could go to the next slide, please. Today's audio is via the phone line, not computer. So please make sure you're dialed into the right number. That number has been also entered in the chat box if you need it again. And it should be showing up on the webinar interface. So I want to make sure folks are getting connected. If you are having any trouble, please let us know via the chat function. We have staff here working on that. Next slide, please. Today we're also working the social media angles, as that's such an important part of communication. Eric Cortez is working to live tweet this session along with our national partners who are joining us for the webinar today. So I want to thank Eric and all of you who are joining us via social media. Please remember to tag at HHS_ViralHub, as well as use the hashtag opioid crisis. Next slide, please. So today, Richard Wolitski and I are joining you here at Washington, D.C. in the Switzer building, and we're just really excited. We had an amazing turnout for today's webinar, and with that, I think we're running short on time, so I'm going to turn it right over to Rich.
Great. Thanks, Corinna. Hello, everybody. Pleasure to be here today with you. And as Corinna's saying, it's something that really seems to be catching fire. We're seeing more and more organizations stepping up to address these issues and to solve these problems as they're experiencing them in their own local communities. So I'm going to provide just a little bit of background from the HHS perspective to get us started. So the first slide. I think as everyone knows, HHS is fully committed to a comprehensive response to the opioid epidemic that's based on the HHS 5-point strategy for combating the opioid crisis. The comprehensive approach is evidence-based, targets the drivers of the epidemic, and I think most importantly for today's discussion, it's flexible in responding to emerging threats, such as infectious disease consequences of the opioid crisis. I won't go over all the specific elements in it. Let's go to the next slide and talk about the impact that we're seeing and why we're here today. Overall, we know that the opioid crisis has led to a dramatic increase in the number of persons who are injecting drugs, and that's what this figure here shows. If you look at the lines in the figure, we see that any opioid injection increased among persons who are 18 to 29 by 622%. And among those people between the ages of 30 and 39, we're seeing admissions to opioid injection increased by 83%. And these are data that come from the CDC. We see a very strong correlation in the next slide between where the opioid epidemic is occurring, as shown on the left by drug overdose death rates, with the numbers of new hepatitis C infections that are reported across the U.S. From the left, the darkest red represents the largest number of opioid overdose deaths, and in the right, we see that the largest number of new HCV infections are represented in the orange colors. And there's a very good correlation between the two. These two things are going hand in hand and fueling each other in some cases. On the next slide, we give just kind of a brief outline of the approach that we believe is needed to battle both of these co-occurring epidemics. We believe that a hidden casualties framework can be beneficial to both the opioid response and to the responses to various infectious diseases that are associated with drug use. I think first and foremost, this is a patient-centered model. This is about meeting the needs of the person who's being served. It's designed to address multiple risks and needs of the individual. It's an approach that meets the needs of all people who use drugs, an emphasis on injection drug users, but recognizing that people who are not yet injectors could be in the future. An approach that helps people to achieve the best health outcomes possible for them, given the issues and threats to their health that they're experiencing. It's collaborative. It works across programs to achieve synergies across programs by taking advantage of leveraging various funding streams that exist across programs, and it extends beyond traditional partnerships to remove various services. And in many cases, can involve non-traditional partners for public health, such as corrections and others. It promotes an approach that integrates services, co-locate services, or if that's not possible, uses facilitated direct referrals to services to facilitate access. It builds on its existing infrastructure. There's no need for a whole new silo here for these responses, and it continues to evolve as the epidemics and as the needs evolve. We go down to the next slide then. This is really an approach that, really, I think Dr. Merman's going to touch on this as well, emphasizes the need for comprehensive community action, where we identify the areas of greatest need, mobilize the community members, including the healthcare providers, law enforcement, and it adapts a comprehensive approach to prevention, including substance use treatment, naloxone, HIV or hepatitis testing, linkage to treatment, and syringe services programs. We all know that syringe services programs have repeatedly been shown to be effective in reducing HIV transmission. Here, we also see that they serve as a gateway to drug treatment as well. One study found that syringe services programs were 5 times more likely to enter drug treatment and 3 more times likely to stop injecting than were those who did not access these programs. And the evidence shows that there's value there, there's cost savings, and so they're good in terms of saving our healthcare resources. So on the next slide, really kind of, recognizes that this is an evolving and changing situation. The early opioid response focused on limiting the supply of drugs and preventing deaths through expanded substance use disorder treatment and naloxone. And they make great progress with that. Many infectious disease programs have not fully integrated key prevention services or partnerships to better serve people who use drugs. So physicians who are seeing people inject drugs are not mentioning and not addressing these issues. And we have a huge potential to make a large difference in the way that our systems work and serve the needs of the people who are coming through our doors and coming to our clinics and our programs. So today, we're going to kind of review some examples of work that's being done in the field, and we're going to want you to answer this question. What is it that you can do? Next slide. Victor, next one. Thank you. We're asking that folks, as a minimum, take a look at what you're doing. Review your programs, your activities to assess how you're addressing the opioid and infectious disease risks and needs in your communities. What are the gaps? What isn't being done that should be done? We want you to think about and identify the opportunities for you to become a part of the response. How can you enhance programs serving people at risk for substance use disorder? How can you encourage new partners to accept or refer for recommended services? And how can you communicate with leadership and funders about community needs and effective programs? So these are some of the challenges that we want to put to you today. And then finally, I think this is going to be my last slide. I want to just make sure that everybody knows about what I think is going to be an incredibly important event that's taking place Monday and Tuesday of next week here in Washington, D.C. The National Academies of Sciences, Engineering, and Medicine is holding a workshop that focuses on integrating infectious disease consequences with the response to the opioid epidemic. This is a workshop that's been co-sponsored by this office and the Office of Women's Health here in the Office of the Assistant Secretary for Health at HHS. And it's really going to focus on the epidemiology of these co-occurring epidemics, how they interact with each other, where the greatest problems are, and we're going to look at what the opportunities are as well. What are the things that can be done to better address infectious disease consequences of the opioid crisis? And it's going to be a great time for folks to see our new Assistant Secretary for Health, who just started a few weeks ago. He's going to be making opening remarks. And for those of you who are not in the Washington, D.C. area, you'll be able to view this live on webcast. And we've got the URL here for that. And you can also go, as always, to the hepatitis website on hhs.gov and get additional information about this program. We hope that many of you will be able to join us here because it really is going to be an important event that I think sets the foundation for the future. So I think I'm turn it back to you, Corinna.
Sure. Thank you, Rich.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.